to this presentation on systematic reviews and also covering some bases around narrative reviews. We're going to talk about some very simple concepts and very simple methodology behind the systematic review. Well, obviously we know there's a wealth of literature out for us as clinicians and us as students to try and decipher and to try and consume. One really important point is if we complete a good systematic review, then we can summarise this in a much more concise format, which makes it much easier for clinicians to practice and to use evidence-based practice, and also for students to learn what we need to do when we graduate, when we start practicing. So completing good systematic reviews within all areas is really important to help with this. So just to go through a few resources that you can use when designing a systematic review and thinking about what you're going to do. Certainly the Cochrane Handbook is fantastic. It's quite large, but it is worthwhile and useful to go through, and Cochrane collaboration has been, I guess, a big driver behind evidence-based practice and the use of systematic reviews to guide clinical practice and use the best available evidence. There's also the PRISMA statement. Now, whenever you go to publish a review or systematic review these days, there's a checklist involved, which the journal will ask you to complete, and this is based primarily around the PRISMA statement. And it's just making sure you consider all of the main things you need to cover as part of your systematic review, making sure you tick the boxes that you've gone through really stringent and good quality methodological processes. Even if you don't cover all boxes or tick all boxes for it, it needs to show that you've considered these, and I guess you need to understand the limitations to your review if you haven't. I also have my very own guide, which will be made available to you online, and there's also the Centre for Reviews and Disseminations guide. Now, the own guide which I have is just a few pages. It's a nice brief summary, and certainly will be a good starting point for you to read and go through after you've watched this online lecture. But in terms of answering every available or every possible question, it certainly won't cover all bases. So certainly the Cochrane Handbook and also the Centre for Reviews and Dissemination guide, which are more like a couple of hundred pages. If you can't find the answer in there, then it probably doesn't exist. So you keep them at your disposal also when you're going through to do your reviews. Now, I'm going to talk to you a little bit about the differences between systematic and narrative reviews. Narrative review is probably more like an assignment that you might have written at undergrad level. Systematic review is a gold standard, and this provides us level 1 evidence. Importantly, systematic review should be repeatable. So if one research group completes a systematic review and follows stringent guidelines, another research group should be able to pick up that methodology, complete the same review, and come up with the same conclusion. And if this is not the case, then probably the stringency of your systematic review may not be high enough. Importantly, it generally summarises quantitative research quite well. Now, if we compare that to a narrative review, one of the advantages of a narrative review is you can have freedom of voice. You can write what you like, and you can bring your opinions out a lot stronger. The issue with this is that obviously you can also bias conclusions and bias the findings of the reviews. The important thing of a narrative review is, in terms of publishing, etc., it doesn't usually require multiple reviews. Something that systematic review requires in order to cross-check things is it requires multiple reviews, or reviewers, should I say. The other thing about narrative reviews, it often lends itself more to broader topics. So if there's a big broad topic with bits and pieces of research here and there, 1 or 2 papers on each subtopic, then it's not really going to be that useful for completing a systematic review, where a narrative review might encompass all of these things. The other advantage of a narrative review is you can encompass qualitative research much easier. So although we're going to talk more about systematic reviews today, narrative reviews certainly do have their place and certainly can be used. So let's look at the gold standard methodology for a systematic review. First of all, we need to propose a relevant question. So we need to come up with something that is important to us as clinicians or important to us as researchers. So we use the PICOS or PICOS, and this is an example for an intervention review. Now, this is broken down into your problem or population, the intervention or interventions that you'd like to look at, comparisons, the outcomes that you want to look at, so outcome measures such as pain. We also want to think about study design as well. So are we going to only include randomised controlled trials, or are we going to look for case series and case studies, etc.? So thinking about what design of studies that you're going to look at. The other thing around a relevant question is we need to make sure it's a very focused and clear question. And this doesn't happen easily. Often it takes a little while to develop this. But importantly, once we have a very clear and focused question, and we have our PICOS sorted out, then we can guide the criteria for our inclusion, and also what we're going to use for our search strategy. Make sure you consider limits, so things like English language. There's a number of limitations in terms of searching, so we might be only looking at human studies. A lot of things to consider, which we'll go through a little bit more shortly. So other types of reviews other than interventions, where PICOS maybe doesn't work as well in terms of outlining, but can still be useful. So if we think about risk factor studies, so this might be a study looking at perhaps is hip strength related to patellofemoral pain, so is it a risk factor? It might also be looking at whether pronation is a risk factor for lower limb injuries, or perhaps some form of blood test for cancer, whatever it might be. So these studies are also very important, which obviously means we want to summarise them in a systematic review. So in this case, we'd use the P, patient population. We could also use the comparison. So our patient population might be patellofemoral pain. We're comparing these people to asymptomatics. And then we use outcome measures, and this could be broad or narrow, and we might be looking at strength of the quadriceps muscles, or we might be looking at strength, movement, and also muscle function. So we might look at strength, EMG, and also range of motion during certain tasks. So it can be quite broad as well. The other thing to consider is you don't have to stick to the one question with a systematic review. You might ask a couple of questions within the same review. So for example, a review which we've just done recently, we looked at the relationship between strength and patellofemoral pain. So we looked for research that compared people with and without pain and compared hip strength. But then we also had a second question is, well, what about the effectiveness of hip strengthening programs? Are they also effective? So here we've looked at intervention-based studies, and we've also looked at more risk factor-based studies. And there are many more options in terms of reviews. This is just going to give you a little bit of guidance, and obviously if you've got a question where you can summarise a lot of literature in the area and come to some conclusions which are going to help guide clinical practice or research, then you've got a relevant question that makes a good review topic. So let's look at some examples. So the PITO for an intervention-based review. So for example, we might look at patellofemoral pain as an intervention. This is one which is about to be published in British Journal of Sports Medicine. We decided we'd look at the effectiveness of patellotaping. Our comparison group was any control intervention or a placebo, but also other interventions. So for example, some of these studies had an exercise group. So we could compare taping to exercise, or importantly, we could compare exercise to exercise plus taping. So thinking about how you're going to tease out how you decide whether something is effective. So coming up with these specific questions is really important. In terms of outcomes, we looked at pain and we looked at function. But we also looked at biomechanics for this review, so we wanted to know how the biomechanics of patellotaping might work. So thinking about what questions you're trying to answer. If you're only interested in pain, then that might be the only outcome measure that you look at extracting from your data. So you need to think about this carefully, and you might narrow this down more based on how much literature and how much evidence is out there. So in terms of biomechanics, for the P here, so we have a biomechanical study, and again, we look at patellofemoral pain. But this time we weren't interested in any interventions. What we were actually interested in is we wanted to compare those with patellofemoral pain to a control or an asymptomatic group, and we wanted to have a look at their gluteal muscle activity. So again, this is another review which we've recently published in British Journal of Sports Medicine. So the intervention is not applicable, but certainly the T, the C, and the O is applicable. So use this as a guide, but you don't have to tick every box depending on what review that you're looking at and what your specific question is. Another example this is a review we're about to start shortly, and what we're thinking about here is we want to know what the effects of foot orthoses are on lower limb biomechanics. So we pick any population, so we don't necessarily stick to one population or another, because we might not have enough evidence for a particular group like patellofemoral pain or Achilles tendinopathy. Our intervention is foot orthoses, and it might be any form of foot orthoses, customised, prefabricated. These are all things you've got to consider. You might be looking at an exercise intervention systematic review or review, in which case you might only be interested in hip exercise, you might only be interested in foot and ankle exercise, or you might be interested in all exercise. So you need to think clearly about what intervention you want to look at. We have a control group where possible, so we might have a group who gets orthotics compared to a group who doesn't, and we look at biomechanical changes between the two. Or in this case, we're actually also interested in within participant design, so a randomised trial where individuals will walk or run or move in just a standard condition of neutral shoes, and then they also walk or run or move in a condition with foot orthoses. So they're their own control. So within participant design is also relevant for this review that we're looking at. And the outcome measure we're particularly focused on is looking at any electromyographic changes. We're interested in neuromotor control. So again, with this might change. We might decide that, okay, there's not enough evidence around neuromotor control and EMG, so maybe we want to look at kinematics and kinetics and the effects of orthotics on that in any population. So you can change this around depending what question that you want to look at. So one thing that I've left off the original PICOS is the S, which is the study design. Now I do this purposely because this is probably something that you want to consider later. The reason being is you want to keep it quite broad until you know exactly what research is out there. This is the easiest to modify later. And most importantly, the S from the PICOS won't necessarily change your question. But what you can do is you can determine what quality of evidence you are able or would like to include, and this depends how much is out there. So you want to aim for the highest level of evidence. So if you're looking at a certain intervention, for example, if you're looking at lateral epicondylalgia and you're looking at conservative management, you might find there's 100-odd studies out there, and if that's the case, then you probably don't want to be reviewing all 100 studies. So you narrow it down, and then all of a sudden you might have 40 randomised controlled trials, which is potentially feasible. So you could restrict it to higher quality level of evidence. The other thing is that you can also narrow some of the other items, so PICO. So for example, if we stay on the theme of lateral epicondylalgia and we've got 40 RCTs, we might decide that that's too big. But if we narrow it down and we say, okay, let's just look at manual therapy for lateral epicondylalgia, then that might narrow us down, and we might have 15 or 20 studies, which makes it a more feasible review to do. So think carefully about how you might change some of these things as you go along, and your question can modify as you start to explore the literature. But the most important thing I can stress is if you're going to go in and do a review, is get started on it early in terms of seeing what literature is out there so you can narrow your question down. So the thing that we need to consider is we must consider criteria for study inclusion, which we've covered a little bit. Once you've narrowed your question, it should not be ambiguous, so make sure whatever studies that you're going for is very clear. So if you're looking for a specific patient population, make sure you just look for studies within that patient population. So if I stick to patellofemoral pain as an example, we may not want to look at anterior knee pain as a whole. We may just want to look at patellofemoral pain when tracking as an issue, and this would be very different in terms of intervention response to something like patellotendinopathy, which might be a separate question in itself. So try not to be ambiguous about what studies you are including. Make sure you address each of the components as appropriate of the PICO, and after we've been through this lecture, sit down, go through, write PICO S down, and then work out, based around what your recent searching has been, what you think your question might involve. And from there you'll be able to brainstorm and narrow it down. And then the other thing that's really important is consider what you should exclude. So things like differential diagnosis, if you're looking at patellofemoral pain, making sure you exclude studies with, say, patellotendinopathy. You might also exclude studies where patients have been included that have had surgery before, because this might be a different patient population. You might not have the resources to translate non-English language articles, so you might need to exclude them. So think carefully about what you also need to exclude. Next step from there is we sit down, we go through our PICO S, and we come up with some ideas about our question, and it might not be completely narrowed by this stage, but hopefully it's getting closer, and then we need to come up with some keywords. Now, whenever you search, and I'm sure we've all searched on Medline or PubMed online, and whenever we search, it's a balance between sensitivity and specificity. So if we stick to the patellofemoral pain theme, I could get online and I could say, okay, if I type in knee, I should get almost any patellofemoral pain study. However, if I type in knee, I'm going to get thousands upon thousands of studies to scroll through. And to try and then narrow it down to patellofemoral pain, it's going to take me probably years to scroll through them. So that's probably not sensitive enough. Now, if I just type in patellofemoral pain, that's going to be very sensitive, and we're probably only going to pick up those studies with patellofemoral pain. But we may also miss some studies. So you also need to consider about specificity as well. So making sure that you're specific about what you want, but also making sure it's sensitive enough to pick them all up. So the key is that to improve your sensitivity, you want to include as many different keywords which might pick up what you're after, but you also want to make it specific so that you only identify things that are relevant to your question. So, for example, if we're looking at patellofemoral pain and we just put in knee, yes, it'll be sensitive, but probably won't be very specific. So we need to include possibly some and search terms. So we might be looking at knee pain or patellofemoral pain, but we're also looking at foot orthosis, so ensuring that we then capture some of the foot orthosis keywords. and brainstorming about how you do that around your PICO is really important. Okay. The other thing is, if you go out and you look for similar reviews in the area, so there might be a review that was done 4 or 5 years ago on the same topic, and certainly you can use that as a guide to guide how you define your search terms, and that might assist. There may be a Cochrane review on the same pathology that you're looking at, for example, maybe Achilles tendinopathy, and it's looked at foot orthoses, but you want to look at eccentric training. So you might use the diagnostic key terms that they've used, and you can go out and you can use those, but then you need to come up with your keywords for what your intervention is, such as eccentric training or exercise. The other thing that you need to consider is you need to make sure you search enough databases. So certainly if you just go out and you search PubMed, sure you'll find a lot of articles, but your chances are you're going to miss some. Not everything is indexed in Medline, which is part of PubMed. So consider searching other databases such as Embase, which is some more European journals, Sports Discus, which might be more sports related, CINAL, which is going to get a lot more allied health-based studies, but also discipline-specific. So there might be a discipline-specific database which you need to search. So look into this and make sure you're searching usually at least 3 databases, and this will give you an idea about how many studies are out there. If you don't search at least 3, chances are you're probably going to miss a few studies in terms of your searching. So the other thing that you need to consider is what other search strategies you can use to ensure that you don't miss any studies that are relevant to your question. So you can do manual searching, and I don't advocate people go out and do lots of this, but if you want to be really, really thorough, certainly this can be a good option where you basically just pick up journals within that area, scroll through, see what you can find relevant to it, but probably going to be very time consuming. Some nice simple ways of looking at things, you can look at reference lists, and you can see what studies have cited other studies. So you might read a paper and you're looking at foot orthosis for patellofemoral pain, and you go through that study and you see, well, what studies have they cited in theirs, and then that will give you an idea about some others that might be there. You can use Web of Science, another search engine, to search for other studies around the area. You can search the author names. You can actually do this in EndNote Web, which I'll go through shortly, but if you search the author name of some studies that you've found, you might find some further studies because they've continued to do some research in that area either before or after their publication, so that can help. You could contact prominent authors, and again, this is probably not something that I strongly encourage, but certainly if you want to make sure you don't miss anything, you might contact them and ask if they've got any unpublished findings which are about to come out. The only time I would probably do this is if you've seen a conference presentation or an abstract and the study looks like it will fit to your systematic review. So if you're going to do a proper systematic review, it's not going to come up in your search strategies because it's yet to be published in a peer-reviewed journal. So what you might do is contact the author and ask, look, how far away are you from publishing this work? I'd really like to include it in the review. And if they say, okay, it's going to be published in the next month, it's impressed, then that's great, you can look at including it. If not, then probably just hold off. The other thing you can do is search for citations of key papers. So some of the studies you find, if you type them into Google Scholar, down on the bottom left, you can actually see what studies have then gone on to cite them. So this will give you some indication about what future research has been done since that paper, and this will just cross-check and make sure you're not missing studies with your search terms. So what I'd encourage you to do is create your preliminary search, get the papers that you initially find, pull them out, go through, look at their reference list, which we talked about, search the author names that you find there, also complete some citation tracking in Google Scholar to see who's gone on to cite them, and that way what you're doing is you're cross-checking that you're not missing anything. Now, if you're finding a lot of extra papers doing these methods, then what you need to think about doing is maybe changing your search terms to ensure that that doesn't happen. If you find that you've not missed any and you're not coming up with any new papers, chances are your search strategy is probably pretty good. So it's a good way of cross-checking things. The other thing in terms of your search strategy, you may want to restrict English language. In an ideal world, you include any language, but you don't always have the resources to translate. But if you do, fantastic, try and get it done. But if you don't, sometimes you've got to be realistic and just restrict to English language. So how do we manage the references? You're going to get a lot of references with all this searching. So if you go online to my EndNote Web, this is a really, really good website, and if you go there, you can actually collate all of your references. Importantly, you can import them from the databases, and you can share the references with others, and it's free. As a student or as a clinician who doesn't necessarily have funding for research software, etc., this is really important. So My EndNote Web, go on there, you can download it. It'll also help you with your referencing when you're writing papers, etc. So definitely get on board and use that. So I'd like to thank you for your time and attention. Hopefully now you can sit down with a pen and paper, go through your PICO-S, come up with your review question, and then from there that should allow you to start to develop your search strategy and start to really think about what questions you want to ask and what questions you can actually answer.